Hi friends, this is Dr. Mehta from Upper Govind Nagar ERA Clinic, Malad East, Mumbai. I wanted to speak about the disease dengue today. It is monsoons in Bombay, and you know that dengue is prevalent in monsoons. And I presume everybody needs to know uh, whatever information they can about dengue. So we start without wasting much time into the basic details of dengue. What are the essential diagnosis patterns of dengue? The exposure is 7 to 10 days before the onset. Sudden onset of high fever, chills, severe aching, headache, sore throat, prostration, and depression. Biphasic fever curve. Initial phase 3 to 7 days, remission few hours to 2 days, second phase 1 to 2 days. The rash is biphasic. First evanescent, followed by maculopapular, scalyniform, mobiliform, or petechial changes from extremities to torso. Leukopenia and thrombocytopenia and the hemorrhagic forms. So, what are the general considerations while dealing with dengue? Dengue is a viral disease transmitted by the bite of the aedes mosquito. It may be caused by one of several serotypes widely distributed between the latitudes 25 north to 25 degrees south. Example is Thailand, India, Philippines, etc. It occurs only in the active mosquito season, warm weather. The incubation period is 3 to 15 days, usually 7 to 10 days on an average. Transmission has occurred in the USA, in certain Texas and Mexican border. A high level of suspicion for dengue is warranted in the United States since a new vector, the Asian tiger mosquito Aedes, was admitted through imported tires in Texas in the 1980s. Clinical findings, symptoms and signs. Dengue is usually a non-specific self-limited febrile illness, but its presentation may range from asymptomatic infection to severe hemorrhage, dengue hemorrhagic fever, and sudden fatal shock, dengue shock syndrome. Severe dengue begins with a sudden onset of high fever, chilliness, and severe aching. Breakbone of the head, back, and extremities, accompanied by sore throat, prostration, depression. There may be conjunctival redness and flushing or blotching of the skin. The initial febrile phase lasts 3 to 7 days, typically but not inevitably, followed by a remission of a few hours to 2 days. The rash appears in 80% of the cases during the remission or during the second febrile phase, which lasts 1 to 2 days and is accompanied by similar but usually milder symptoms than in the first phase. The rash may be of different types. It appears first on the dorsum of the hands and the feet and spreads to the arms, legs, trunk, and neck, but rarely to the face. The rash lasts 2 hours to several days and may be followed by desquamation. Petechial rashes and gastrointestinal hemorrhages occur with dengue fever caused by strains of many mosquitoes in Asia. Before the rash of dengue appears, it is difficult to distinguish from malaria, yellow fever, or influenza. The rash makes dengue far more likely. A positive tourniquet test should alert one of the possible development of hemorrhagic fever. A subset of patients progress to dengue shock syndrome, in which a capillary leak process is prominent. Laboratory findings. Leukopenia is characteristic. Leukopenia, by the way, is less WBCs. So if you see less WBCs in a CVC finding of dengue, Uh, One of the diagnostic factors for dengue is leukopenia. Thrombocytopenia occurs in the hemorrhagic form of the disease and appears to correlate with early CD69 expression on peripheral lymphocytes. Virus may be recovered from the blood during the acute phase. Complications: depression, pneumonia, bone marrow failure, iritis, orchitis, oophoриtis are unusual complications. Dengue shock syndrome occurs among a small subset of patients with severe dengue hemorrhagic fever, and children appear to be at particular risk. Prevention: prophylactic measures include control of mosquitoes by screening and insect repellents, particularly during early morning and late afternoon exposures. An effective vaccine has been developed but not been produced commercially. Treatment: treatments entails appropriate use of volume and pressors, acetaminophen rather than aspirin for analgesia, and the gradual restoration of activity during the prolonged convalescence. Monitoring patients with platelet counts is useful in anticipating the complications of dengue hemorrhagic fever or shock syndrome. Thank you. This was Dr. Romal Mehta from ERA Clinic, Upper Govindagar, Malad East. Just a small measure to let you know something about dengue during the monsoons. Thank you very much and keep tuned to my channel.